The world of cancer care is fascinating and changing rapidly. Hello, I'm Dr. Bob Morali for Salinas Valley Memorial Healthcare System. And for the next half hour, we'll explore this remarkable area of medicine. From the high-tech intricacies of radiation therapy and mammography to cancer research that's conducted at Salinas Valley Memorial's Comprehensive Cancer Center, to the remarkable stories of hope and courage. We begin with one such story.
Good afternoon.
Dory Galster is a cancer survivor.
Dory from Occupational Therapy, how are you doing today?
Now an occupational therapist at Salinas Valley Memorial, when Dory was just 15 years old, her parents received the news they feared the most.
It was confirmed that she had leukemia.
My parents were pretty devastated and crying, and so I, just instinct of, I was okay and I could handle this.
Total devastation. It's just like a puzzle piece that you can't get it to fit anywhere. It just doesn't, why, I think it was why her, why not me? I think all parents would rather they go through it than their children.
There were days where I was so weak where I couldn't hold my head up. I know my doctor was pretty insistent on, keeping focus forward and really concentrating on building a future after this.
Brave and straightforward 16-year-old. I mean, she was willing to go for a cure and do what had to be done.
And my family is really supportive as well, so I don't think they really let me go there.
I remember just holding her and I said, Dory, you can feel too tired to pray, you can feel mad, you can feel frustrated, but you don't give up.
Dory never did give up. In fact, she became an inspiration to others in their battle against cancer.
So Dory came to our adult cancer support group, and Dory didn't talk a whole lot, but Dory packed a wallop. You cannot imagine how many adult cancer patients thought, if that little girl can do chemotherapy, I can do chemotherapy.
She was the star of the support group. I mean, they had people in their 60s and 70s. They had people that were not even close to her age, but she could relate to them because she was going through kind of the same thing they were going through.
Though Dory was Salinas Valley Memorial's first pediatric cancer patient, shortly after she was admitted, 2 other teenagers became cancer patients here as well.
This is a picture of one of the other teenagers that was diagnosed the same time as I was.
The 3 teams developed a camaraderie, but Dory was the only survivor.
Keep going back to that, and out of 3 people, why was I the lucky one? So I'm just really grateful for that, and I definitely, think of them constantly, just, wondering, what if?
Today, Dory, her husband, and her family, like so many others touched by this disease, know the gift of cancer.
I just feel it definitely puts things into perspective as far as importance of life issues.
I think our outlook on life changed. It's the simple, minor little details, things in life that mean more to us. Time with our grandchildren, time with our children.
You're more aware of just the people around you who love you and who are supportive of you, and know that relationship is a gift as well. You never know what's going to happen to anybody.
One thing Dory and her family didn't know was whether the cancer treatment left her body unable to have children.
When we got married, we both wanted children. And we kind of both, I think it was kind of maybe in the back of our mind that, there may be a chance that we might not be able to.
Basically, they killed off everything in my body. How possibly could everything still be functioning? There's always stories about, the cost of the cure and, what's happening to people after they go through chemotherapy. And so I was definitely worried about it.
But that worry turned to happiness with the birth of now 2-year-old Elijah.
He's a miracle. That child is a miracle. He came in the world, 10 pounds, 4 ounces? He was bigger than she was.
Having my first child, I thought maybe this is it. Maybe it was just a blessing from God and a fluke, and this is it. But now, pregnant with number 2, it's wonderful. I've always wanted to be a mom.
It's amazing. Hopefully a lot of her dreams came true. that we weren't sure were going to come true. Here's a little blessing right over there running around on the jungle gym. Just another one coming. It is amazing.
The best advice that I got was not to give up and just to keep looking forward to your future.
Dory's physician, Dr. Patrick Flanagan, is one of 3 medical oncologists on the front line of cancer care here at Salinas Valley Memorial.
Oncology program is a great resource for the community. It's a program that has always been interested in bringing latest technologies to the community so that people can be treated in the safest and the most effective fashion close to home.
We collaborate closely with the academic centers for cancers that are unusual.
The physicians in our community are at the same page with one of the academic and larger institutions, then patient can feel comfortable that their treatment is, even in this small community town, is at the same level as it would be in any bigger institution.
We do collaborate both through meetings, through emails, through phone calls with both Stanford and UC San Francisco to make sure that we are providing up-to-the-minute care for our patients.
We do have a lot more to offer than we did 10 or 20 years ago. We're a lot better at controlling symptoms now. We have better programs for anti-nausea, better programs for treating possible infections that might arise if blood counts drop.
When I talk to my patients, it always comes to my mind that how would I want to be treated if I was in a different place? And patients want best from the doctors.
You can look at any patient. You know, this could be your child, this could be your spouse, this could be your mother, this could be your grandmother, your grandfather. So there's a personal level to the care that we provide.
Whenever you see particularly somebody who's your age and has kids your age and has a family just like yourself, and then you're talking to them and giving them the time frames, it's just heartbreaking. It's heartbreaking.
Life and death are the most intimate, incredibly intense times of a person's life, and I feel very grateful to be involved in that process with people.
But it also puts you to think and live in a whole different perspective, and all the things that you have been taken as granted, you know, take a whole different meaning, because the person sitting in front of you didn't do anything wrong to deserve this. And it could as easily have been yourself sitting on the other side of the table. So, you know, it just gives you a whole different meaning and perspective on life.
It's an honor to take care of patients who are at the most critical point in their lives, and to be present with them during this experience, and to share their pain, to share their hope, and to be able to provide comfort and hopefully life.
Radiation therapy is a highly targeted, highly effective way to destroy cancer cells. Here, a young woman with a brain tumor prepares for one of her daily radiation treatments. Beams of radiation are focused on the cancer cells. Over time, those cells are destroyed.
We use radiation as a means to kill the cancer cells. So the goal is not just to stop the cancer cells from spreading, but the goal is actually to try to kill the cancer cells.
The computer revolution have allowed us to take advantage of things that were not even imaginable just 10 years ago. Being able to treat a tumor, let's say, behind the eye without really giving the much dose of the radiation to the eye itself is something that was impossible even to conceive 10 years ago, but now is possible with this computer-assisted treatment.
With the combination with chemotherapy and surgery, I think the cure rate of cancer is getting better every year.
The new machinery will allow us to deliver this radiation in ever higher doses, which we hope will be more curable, to organs that need the dose, but the surrounding tissues don't need it. And using a computer interface and this new technology, we hope to be able to give patients more effective and perhaps more curable treatment with less toxicity. And this means greater comfort for the patient, potentially greater chances of curing because we can give higher doses, and greater assurance that we're doing what we need to, because we can actually see on a daily basis with this new technology exactly what we're treating and verify that we're getting it every single day.
Well, I find it extremely rewarding, because when I see the patients coming back and tell me and thank me about what I've done and that changed their lives, make their life much better. That's extremely rewarding for me.
Breast cancer in the early stages can be very curable, and we have so many treatments nowadays. We have not only surgery but chemotherapy, many different types, targeted therapies that go right to the cancer cell. We have hormonal therapies, and so we really have a way of treating it that is different than we've done in the past, and it is very, very treatable and very curable in many, many cases. So early detection is the key. The earlier it's detected, the better chance you have of curing breast cancer.
And then there's another one. Okay, so this would be good for you to read. This is about the radiation part. It's external beam radiation.
This is such a scary disease, not only cancer, but breast cancer in particular, and very emotional for the woman and the family. But I do follow women through their treatment process, and whether they need just the surgery and radiation or surgery, radiation, maybe chemotherapy as well. When they're finished with treatment, they are done, and you go on to get their lives back and go on to lead a normal life, and of course get checkups regularly after that. But yes, we've had many, many patients who are looking back on their year of treatment or 6 months of treatment or whatever it was, and they're very far away from that now. They're going on with their lives. Yeah, it's very gratifying to see that.
And that disappears over time. So you might need some extra pillows or soft pillows to kind of, make yourself comfortable at night. Yeah, I did that after my surgery.
Our services are available to the public free of charge. You do not need a doctor referral, so anyone can call, ask a question, or get information. And our number is 755-0791. That's at the Cancer Resource Center, Salinas Valley Memorial Hospital. Or go to our website at www.svmh.com.
Okay, Virginia, I'm just going to bring you right on in here. We're going to do the left breast first here, and we're going to have a little compression.
Our purpose in the Mammography Center is to find cancers at an early stage, and to do that we primarily rely on mammography, which is the most sensitive means of determining early breast cancer.
When I first started, most of my patients who came to me with breast cancer came because they felt a lump. Now I'm seeing most of my cancers be much more early stage and being diagnosed on mammography when nobody can even feel a lump.
Since we're finding breast cancer so much earlier, the death rate from the incidence of breast cancer hasn't dropped recently, but the death rate, or the number of deaths from breast cancer, has actually dropped.
One reason for earlier detection is mammography's sophisticated technology. The R2 image checker is a computerized review of mammograms, detecting suspicious areas for a physician's review.
It's a second reader that never gets tired. Just as we look at the mammogram and compare for asymmetries and possible subtle calcifications or masses, the computer does the same sort of analysis after the image is digitized. To do this, in addition to what I do, increases the level of accuracy in the mammogram considerably.
Accuracy is critical in the diagnosis of breast cancer. Radiologists also use ultrasound when breast cancer is suspected.
We have 2 ultrasound units that provide us with state-of-the-art analysis of masses or densities that we may find, and I feel comfortable knowing that you told me the lump is here. We put the transducer on the lump, and I can determine that that lump is what you feel, and that is a cyst, and that is benign, and we're done.
Another area of innovation is in the way biopsies are performed.
The actual biopsy procedure has changed dramatically. It used to be, I used to have to do a surgical procedure to make the diagnosis. Now, I would say the majority of breast cancer patients are having what we call the stereotactic or the core biopsy, which we've been doing in this community for over 10 years.
We'll take perhaps a dozen samples. Screening mammograms save lives, and that's the bottom line. To all women, I would say they need to have a mammogram. We have state-of-the-art equipment. I believe that we have found many cancers that are very early at a curable stage, and that we have saved lives as a result of doing that.
Well, this is not Chanel number 5, but we're going to do a class here, and it's going to be a great class.
Lydia Anderson volunteers her time each month to work with cancer patients, helping them feel better by looking better.
When you look good, you just feel better. It's the way it is. When you don't feel good and you're just tired, you don't want to go anywhere. So coming to this, everyone that has ever come just feels so much better. I love makeup. Oh my gosh. I buy makeup all the time. How about you?
I like this class that they just gave me because it does make you feel a little better. Because in I guess the type of cancer I have, I feel you do tend to feel a little bit ugly. You know, you're not the same person in a sense. Not just the hair loss, but the loss of a breast. It just, you don't feel complete. And there's some days that you do feel kind of ugly and you don't want to go out. And this class here, it makes you kind of feel better about yourself.
They come in, and they don't want to be here. They don't want anybody to see them. And then the minute they come in, they get their makeup and they know that other people are going through what they're going through. And they don't want to wear a wig. They don't want to wear hats. And then after they leave, they're so happy. I get a lot of compliments, and I don't know, I just feel really good about it. It's really nice. On most of these eyeshadows, I would just use light because you want to look like you're not tired at all.
Cancer is a familiar foe for Lydia. Her husband and son are both cancer survivors. Through this American Cancer Society program, Lydia is able to provide women with free wigs, cosmetics, and teach them how to use scarves and hats.
And a class like this today just makes you feel so much better. And some of the ladies today, putting the wigs on and the scarves and showing them how to do their makeup, you could just see the brightness in their eyes. You really could. And it makes you feel good inside too.
Oh, they come in and they're just really scared. And when they leave, they're really happy. They're really happy. I really love it. To make somebody happy, it just makes me feel good that they look good. It does.
It's just phenomenal what science is doing. We have a really good, committed team, strong group of physicians and a whole multidisciplinary team.
2 or 3 factors that come into play. One is the histological type. Obviously,
every week, physicians, nurses, and other members of the cancer care team meet to review current cancer cases.
We take basically every breast cancer case that comes through and it's discussed. We talk about the patient, first of all, how it presented, how it was found, look at the x-rays, the mammograms, the ultrasounds, and based on all of those things, we come up with a plan for the initial treatment. Basically, the breast cancer is talked about every second week, and in the alternate week, we talk about either interesting or very difficult cases.
These sessions are shared with physicians at Me Memorial Hospital in King City through teleconferencing, which allows two-way communication between the two hospitals.
Neil's involved, and the information I have is that there was an abnormal chest.
The Comprehensive Cancer Program at Salinas Valley Memorial actively participates in clinical trials, which allows the latest medications and treatments to be used right here.
By having the clinical trials showing a high standard of care in our community, we are showing that we're interested in progressive research for future generations with cancer.
Cancer is something that's very personal to me. It's hit our family hard, and in some ways it's almost a vendetta.
Cancer care is a high priority for Salinas Valley Memorial President CEO Sam Downing. Congratulations, I understand you've received the designation Comprehensive Cancer Center. What's the significance of that?
Well, it requires a certain level that states to the community that you have a strong educational program for your physicians. You have case review, and the physicians agree to review each other's cases, and then you also send them out to other people that are in, like, let's say, the Western United States, and they'll look at the care, and it puts you under the microscope, because the first thing people say is, gosh, you know, you have everything here that they might have at one of the big universities. And we have, through computerization and teleconferencing, gosh, we've been really fortunate in the last 10 years to bring all these resources to the hospital. And with our connection with NASA being the only community hospital that has a Space Act agreement with them, it allows us to bring a lot of manufacturers in here that might want to test certain drugs that would only be at a university. And they like the affiliation with NASA, so they're, you know, we're kind of networking with each other. The whole comprehensive word stands for itself. It means you have a total program that meets the needs of the patient and family.
The Comprehensive Cancer Program at Salinas Valley Memorial treats the whole person, body, mind, and spirit.
This kind of music has been going on for centuries. The monks in Cluny, France were doing this in the 13th or 14th century. They would go out with their instruments and play for people like this. And over time, knowledge accumulated about the healing effects that it does have.
So it was so wonderful. I could hear this music starting to play in the background. And all of a sudden I could just feel my spirit being lifted up and encouraged. That was, you know, I was just thinking, this was such a wonderful, wonderful thing to experience. I just want to thank the hospital. It was a delight. It was like, wow. I mean, who would expect to be sitting in a hospital bed and hear this fabulous music coming forth? I mean, it just makes you feel kind of special.
I know that it has an effect because people tell me that all the time. And they're very grateful. People are very grateful to have music at a time when they're not feeling good.
Music is also a tool used by Jack Cheney, a certified art therapist who works with patients at Salinas Valley Memorial.
Hi, I'm Jack Cheney.
Mr. Cheney,
I'm the art and music therapist around here.
Here he works with a patient in guided imagery and meditation who is scheduled for surgery the next day.
Let's just use the imagination for a second. Just close your eyes. As you're breathing and listening to the flute, I want you to imagine your body going through this procedure that you're going to be doing tomorrow and coming out and healing all of the tissues that need to be healed, healing quickly, efficiently, and you returning to your life in record time. What I love about my job is that I see people set aside their anxiety, that through creative means and through self-expression, they can let go of the anxiety and the sense of alienation and take control of their own recovery. If you're going to treat the whole patient, then you have to consider the emotional, the mental, and the spiritual health of the person that's going through whatever life-threatening crisis that they're going through. See if I can hook you up with a song that you might remember.
Favorite song, Judy Garland.
Well, this is a tremendous facility, first of all. Not every hospital has creative arts therapy, energy healing. They teach the nurses Reiki. So my hat's off to the directors of this place that they see the whole picture.
Where over the rainbow, way up high, there's a land that I've heard of once. Thank you, sir. You're a gentleman.
Yeah, it takes one to know one.
They're not in this battle alone. We have many, many, many people who are ready, willing, and able to help you share the burden.
The support group, I think, is the key to mental health for a lot of people. It bolsters you, makes you laugh, makes you cry. They helped you get through it. And without them, I tell you, it would be tough.
I think support groups provide just this tremendous sense of you're not alone in this.
To shoulder height, palms up, reach to the skies.
Besides support groups, Salinas Valley Memorial offers patients workshops on a wide range of topics. In this group, women are led in Qigong, an ancient form of meditative exercise.
Traditionally in medicine, we often looked at the physical body as separate from the emotional body or thought patterns, and that was in the realm of psychology or psychiatry. Well, more recent science has shown that it is all interconnected. There's no doubt in science that there's a mind-body connection.
The Comprehensive Cancer Center at Salinas Valley Memorial is just that, comprehensive. As we close, some thoughts from some of our patients and family. Thanks for joining us. I'm Dr. Bob Morali.
Well, my situation is testicular cancer. It started in December. I didn't realize I had a problem until we were in Disneyland, and we were on the rides and started getting sore and almost like somebody was kicking me somewhere where I'm not supposed to be kicked, you know, and it didn't feel right. And that's when we went in for, you know, the scans and stuff and determined that there was something there that didn't belong. There's indications that it's grown and that it's moving. I consider it kind of I guess a blessing. Like, I need to go through this. It's something I have to do. It's something better for my being. I can't explain why, but I always believe that there's always something good comes out of the bad. When you have something in front of you that actually can take your life, you realize that all those other things didn't really matter. All of a sudden, everything you look at is not as important as it used to be and makes life grander. I'm not going nowhere. That's how I look at it. That's how I feel. I'm going to be fine. I'm going to be fine, no doubt.
I have 2 boys, so I told them that everything's going to be okay. I haven't broken down, to be honest with you. I've taken it okay.
Oh, I can remember my husband and I crying together. And I remember saying to him, I don't want to die. And it just brings tears to my eyes remembering that. And it's not the end of the world. And if you can have this the support and the optimism, you can get through this and you can go on and have a great life. Could I just read something real short to you? I thought it was really nice. What cancer cannot do. Cancer is so limited. It cannot cripple love. It cannot shatter hope. It cannot corrode faith. It cannot destroy peace. It cannot kill friendship. It cannot suppress memories. It cannot silence courage. It cannot invade the soul. It cannot steal eternal life. It cannot conquer the spirit.